Upstate Medical University in Syracuse, New York, invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. A new clinic offering advanced care for inherited arrhythmia syndromes is available now at Upstate. I'll be talking with two of the team members of the channelopathy clinic, cardiologist Jorge Romero and arrhythmia researcher David Auerbach. Welcome to the Informed Patient, both of you.
Thank you for including us.
Thank you, Amber.
Let's start with an explanation of what this channelopathy clinic is designed for. What are inherited arrhythmia syndromes? Dr. Auerbach?
An inherited arrhythmia, you can think of it as there's a typo in your DNA sequence. This gene and protein isn't made properly, so it behaves abnormally, and thus that can disturb the normal electrical function in the heart, which can provide a substrate or underlying cause for people to be at an increased risk of arrhythmias.
Are these common? Do these happen often?
It depends on the type of syndrome there. For example, long QT syndrome, which we may dig into a little deeper later on, it's about 1 in 2,000 people. But some other forms of inherited arrhythmias like short QT syndrome is extremely rare.
Yeah, just to add to that, of course, there are rare if you compare to the most common arrhythmias such as atrial fibrillation that are based on aging and other risk factors like high blood pressure and diabetes and lifestyle patterns. But as David mentioned, long QT syndrome is 1 in 2,000. So it's rare, but not that infrequent. So we know that these electrical problems affect thousands of patients in the United States and around the world.
And what is the danger of inherited arrhythmias that are not diagnosed or treated?
So initially, I have to give all the credit to Dave Auerbach because he was the one who designed and created the concept of this clinic. And he's done tremendous amount of research, especially in long QT and epilepsy. And he's going to explain why they connect to each other. Why we created this clinic is for something very special, is that we noted that several patients in our community were misdiagnosed or not diagnosed at all when they have genetic electrical problems. So the main objective of this clinic is to try to identify the mutation that is causing the problem. And once we know what mutation we're dealing with, we have a variety of treatments for our patients that include medications, lifestyle modifications, ablations, and some patients are going to need pacemakers or defibrillators.
Comes a whole family situation here too. In particular, when we identify someone with an inherited arrhythmia, likely that gene variant was either passed on from their parents or they also may be likely to pass that on to their children. So it really becomes a whole family discussion and optimizing the care of the whole family.
If I can interrupt, you may start with one patient and then other family members become involved?
Yes. So most of the time we get the index patient, that the patient that comes for a visit, but most of the time for most of these genetic electrical problems, we're going to test first degree and sometimes second degree relatives. So as Dave mentioned, most of these disorders follow an autosomic dominant pattern. So every relative has up to 50% chance to have the same mutation or the same genetic variant. And the expression is different in every single patient, but genetically speaking, they do have high risk of having the same mutation.
So do the index patients, the first people that come to you seeking a diagnosis, do they necessarily have symptoms themselves, or have they learned of a relative that has something and they want to check themselves out?
Both. I think most of our patients that we've seen in this clinic so far, they do have symptoms such as fainting, drowning, they have unexplained accidents, or they have family history of sudden cardiac death. But most patients do present with some kind of symptoms or some kind of electrocardiographic findings that they find in the emergency department or with the primary care physician.
Do they need a referral from their primary care provider or a cardiologist?
Most patients are referred from the emergency department, primary care physicians, cardiologists, heart failure attendings, or any kind of physician, but probably 10-20% of these patients are self-referred.
Is this just for adults or are children potential patients as well?
This clinic, because we just created this clinic 2 months ago, is only for adults, but we're trying to invite our pediatrician colleagues to join us in this venture.
And I know cardiologists and researchers are involved, but what are the other members of the channelopathy clinic team?
These conditions really require a multidisciplinary type team because they are somewhat rare. It requires specialized care for these people, and also they're at a high risk of arrhythmia. So it involves cardiologists, particularly those with extensive training in cardiac electrophysiology, researchers, geneticists, as well to help interpret some of the genetic reports, pharmacists to understand what medications may or may not increase the risk of arrhythmias in these various conditions.
Could patients become research participants? Do you have trials that are underway that they could join?
Yes, my initial introduction to this field was I had the fortune of working with a large registry. It was the Lung QT registry. And this registry was so valuable because it didn't just include people with Lung QT syndrome, it included all their affected and unaffected family members. Results from these registries have really helped guide the field in the optimal diagnosis and care of people with Lung QT syndrome. Beyond just the care of that individual person, by building these registries that can help guide the standard of care for each of these inherited diseases.
This is Upstate's The Informed Patient Podcast. I'm your host, Amber Smith. I'm talking with cardiologist Jorge Romero and Dr. David Auerbach, who is an assistant professor of pharmacology at Upstate, about a new channelopathy clinic. Dr. Romero, can you tell us about the services that are offered through the channelopathy clinic and sort of walk us through what a patient could expect from the first visit?
Yes, of course. So initially, the patient is going to meet Dave and myself, some of the fellows. And the initial visit, we usually take a long time reviewing all the electrocardiographic, the EKGs that the patient have in the last 2 or 3 years, just to try to find clues for the mutation that they may have. Then we review all the imaging testing. Most of our patients undergo full genetic testing, and then that's going to give us a lot of information. Of course, once we identify the mutation, we offer different treatments. For example, for Lung QT syndrome, that is probably the main condition that we treat. Most of those patients are going to have Lung QT syndrome type 1 or 2, and those two entities are treated with beta blockers, with nadolol or propranolol, very well tolerated medications. However, some patients don't respond to medications, and they're going to need more advanced therapies. Here at SUNY Upstate, we have created the autonomic modulation program, in which we're going to create cardiac denervation. So we try to minimize the amount of adrenaline, epinephrine, and norepinephrine that goes into the heart. And in 24 to 48 hours after this procedure, you can see how the QT interval is essentially corrected. It's impressive. It's the same thing for other disorders like Brugada syndrome. Now we know a medication that is called quinidine, a medication that treats that entity very successfully. However, if patients have more syncope or cardiac events, then we can do now epicardial mapping and ablation with excellent results.
We've used the term Lung QT syndrome. Can you explain what that is to a patient? Is it an irregular heartbeat?
No, so Lung QT syndrome, the regular 12-lead electrocardiogram has different intervals and different parameters. So the QT is a measure that we take from the onset of the QRS to the end of the T wave. And in normal patients, we know that that interval shouldn't be more than 450 or 460, depending if you're a woman or a man. But we worry when that interval is more than 500 milliseconds because those patients are at higher risk of having sudden cardiac death, especially during special circumstances. For example, when you have a Lung QT syndrome type 1, most of those patients experience a syncope during exercise or swimming. If you have Lung QT syndrome type 2, the key component is that they go into ventricular fibrillation or polymorphic VT due to like loud noises. So that's how we take a history of every single patient very carefully, because that's going to guide us to the final diagnosis.
You mentioned the genetic testing that most of the patients will go through. How many genes are tied to channelopathies? Dr. Auerbach?
I don't think we actually know the number. As the level of comprehensiveness of genetic testing is growing at an exponential rate, we are identifying new variants in genes constantly. And it originally started out with various genes that are linked to controlling electrical function in the heart, but now we're beginning to understand even more some of the other genes or proteins that interact with these original channels have a great role too. So I don't think we've at this point really understand the level of complexity that there is here.
Well, Dr. Romero, getting back to that first patient visit, would you take a blood sample to send off for genetic testing, or how's the genetic testing done?
We used to do it that way a couple of years ago, but now with just a swab, it takes 2 seconds, no blood involved, just with the saliva. It's very simple.
Is there any advice for how a patient should prepare for the appointment? Is there anything they need to bring with them, or do they need to dress a certain way?
Not really, but the most important thing is try to collect. If it's not an internal patient, then we don't have access to that data. So we ask patients to collect all the electrocardiograms, the echocardiograms, the cardiac MRIs, all the testing that has been done in other institutions. Even though most likely we're going to retest here for everything because there's a lot of inter-observer variability.
A valuable piece of information also that they can bring is their family history, speaking with their family to understand, has anyone died suddenly, particularly at a young age? What were the circumstances of that? Can help us better understand the situation.
Is it only the cardiac family history that matters, or are there other parts of the family history that you would want to know about?
Well, thank you for bringing that up. My laboratory actually takes a very multi-system approach to studying many of these diseases. And we've come to learn that a disease may have initial presentation in a classic organ of study, but we realize that this same genetic variant may be disturbing electrical function elsewhere in the body. For example, people with epilepsy are also at increased risk of cardiac arrhythmias. So it really takes a multidisciplinary team and approach to optimizing the care in these patients.
Is there anything that can be done proactively? If someone has an inherited arrhythmia and they want to start a family, can you prevent an arrhythmia from being handed down to that baby? Dr. Romero?
Essentially, as I mentioned before, the baby, for some of them that have autosomal dominant fashion transmission, then most of them have 50% chances to carry the mutation, unfortunately. But knowing, even though this is frightening and anxiety provoking diagnosis, once you know what you're treating, all these problems are manageable with the right lifestyle, with the medications, with ablation. Most of our family have children without any problems. Yeah.
Do we understand enough about the cause of various arrhythmias? I know there's a lot more to learn about the genetic causes, but are there other factors that we're still investigating?
Yes, particularly here in the central New York area and at Upstate has really been a major hotbed of cardiac electrophysiology research. And over the past 50 years, a lot of the critical information to understand the mechanisms for the initiation and maintenance of these arrhythmias have been discovered here in the central New York area. And there are several major triggers for arrhythmias. For example, when you were talking about long QT syndrome, you don't want the next beat to hit the tail of the previous one because that can cause disturbances, or when there's hyperexcitability, when cells in the heart start firing abnormally, these can provide triggers for arrhythmias.
Would you say the research is focused on finding treatments or preventives for arrhythmias?
I think definitely finding treatments for these genetic disorders.
How is your clinic helping in our long-term understanding of inherited arrhythmias?
What we're trying to do is, as I mentioned before, trying to diagnose first before we going into the treatment, try to understand and diagnose several patients that have been either not diagnosed at all or misdiagnosed with epilepsy, with other problems that are not the real cardiac issue that we need to treat. So, of course, we're going to try to activate randomized controlled trials to try different therapies, but we need to build our volume first before we start enrolling patients for big studies.
Well, it's nice to know that the channelopathy clinic exists and that it's available for people that need it. Thank both of you for making time to tell us about it.
Thank you, Amber.
Thank you.
My guests have been Upstate Cardiologist Jorge Romero and Assistant Professor of Pharmacology Dr. David Auerbach. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes and transcripts at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.